Hello, everybody, and welcome to another episode of Fun Facts at the Pharmacy. I am your host, Dr. Christopher Greider. In case this is the first time you're ever checking out this show, the purpose of the show is to kind of give you guys some basic health information to make better decisions throughout your life, to see if there's things that you need to double check with your doctors or your pharmacist with, and to kind of help cover some things about medications as well. The beginning portion of this is our fast acting. So for today, what we're going to talk about actually is it's been a few years now. We've been dealing with COVID for a while, and to be honest, it's still a current thing. At the time of this recording, they did make some current updates that were going on with the vaccinations that were available. So right now, there are still 3 vaccines that are available: the Johnson & Johnson, the Moderna, and the Pfizer. The changes in the recommendations are that they've actually decreased the age threshold now. So it goes as young as 6 months old. The reason that I'm bringing this up right now is that because of the change with the ages, some pharmacies, especially in the community setting, they may not be as comfortable with giving vaccines to children that young. So even though the CDC does recommend it, it is something that's allowed by pharmacies to do. The hard part about it is that most pharmacists have not actually been trained to do children as young as 6 months old. So I always tell patients, double check with your pharmacy before you go in and ask for it on the spot, because a lot of places can do walk-ins at this time for initial shots or for booster vaccines. But with that being the case, like I said, with being uncomfortable with doing children that young, you may have to check with your pharmacy that you're looking to go to see if they even vaccinate that young from the 6 months to 4 years old. The other thing to realize is that the dosing and regimens that they have for these vaccines are much lower. So the only ones that have currently been approved are both the Pfizer and the Moderna vaccine for those age groups. At the time of this recording too, they are currently working on approving from the 5 to 17-year-olds for the Moderna. So it's kind of a weird middle gap area where it hasn't been fully approved yet for that age range, but they do have the lower doses and the ones for 18 and older. Across the board, Pfizer has been approved for all of them. So with that being the case right now, I would recommend double checking with your pharmacies to see if they're doing within the age groups and that if they have the vaccine available. The dosings were lower, and for the children ages 6 months to 4 years old, the dosing scheme is a little bit different too, because it's actually spread over 3 vaccines instead of 2 for the initial dosing. So with that being the case right now, we want to make sure that they have everything available and that also that they're willing to do children that young. I know personally for my pharmacy, the youngest that I've done so far has been about 8 years old, and that's typically okay as long as the parents are there to help out. But the biggest thing is that sometimes if your children are acting up or being kind of rebellious about it, the one thing to keep in mind is that most pharmacies don't have a lot of time, so you have to double check to make sure that your child is pretty much ready to go, because they may turn you away also just because of the fact that they don't have the time to kind of get your child back under control. So with that being the case, as a parent, we actually ask if you can help out with us, or if worse comes to worse, sometimes double checking with the pediatrician's office, because most of them will typically offer the vaccine. So it may be easier with having the staff of the nurse and the physicians there that they may know or the children may feel more comfortable with to do the vaccines there. Besides that, to be honest, it is the most effective means of protecting you from the COVID virus right now. They are currently looking at during the fall times to see if they need to make any variations of a new vaccine. So right now, everything is still the exact same dosing, same regimen, same everything. But I know a few of the companies have also been working on variations of it. So for example, Moderna in particular, last I had heard they were working on trying to get a vaccine that contains both the COVID booster vaccine along with a flu shot all combined into one vaccine to make it a little bit easier so that you only have to get one shot for everything rather than having to do multiple shots to get everything done, especially around the fall time. So with that in mind, like I said, double check with your doctors, your physicians, if you are still interested in getting it done. They do highly recommend getting it done because, to be honest, COVID will not be going anywhere anytime soon. It may be similar to like the flu vaccine where it may be something that's required yearly, but we have to monitor and just watch for it and kind of go moment to moment about it. So the portion that we're talking about today, the most important thing right now, is we're actually looking at, it's that time of the year where allergies tend to be extremely severe for most people. I always get questions nonstop at my pharmacy about whether or not, what should I use, what's recommended, what are the symptoms I should be looking at, do I have a COVID, the flu, the cold, is it just my allergies? So with that being the case, we figured we might want to break it down a bit more for you guys to kind of talk about allergies in general. So to help me with that today, I actually have a student with me from Neomed, and her name is Angela, so let's introduce Angela.
my name is Angela. I'm a fourth-year student at Neomed.
Okay. So kind of taking a look at it right now. So when we're talking about allergies, or like a common medical term that you hear is allergic rhinitis. So what are we talking about when we say that?
So allergic rhinitis is like an allergic response produced by the immune system that causes symptoms such as like sneezing, runny or stuffy nose, or like watery or itchy eyes. And according to the World Health Organization, allergies are a common condition affecting more than 30% of the world population.
Perfect. So with that being the case right now, I mean, we're always looking at like what's the cause of it, because when we're trying to figure out, therapies or treatments or anything like that to help with it, we kind of want to know what's the main source of it and what's causing it. So can you tell us a little bit about maybe what could be a trigger point that can cause allergies for people?
So one of the most common allergens that we experience in excess, especially during the spring, summer, and fall months, is pollen. So pollen could come in 3 different types. There's like ragweed pollen, there's tree pollen, there's grass pollen. Some other common allergens that you might experience can be allergies to like dust mites or cockroaches. There's also mold and like animal dander that can bother you. And depending on the number of allergens you react to, it's possible to have symptoms like seasonally, or you can have it episodically or even all year round.
Okay, so it's typically like a trigger point for certain times of the year, it seems like, but like you said, it seems like there's certain allergens, like dust mites are very common in the household, or even pet dander, that sort of thing. So. Mm-hmm. Okay. So you had mentioned some of the symptoms. So typically, what would somebody normally experience if they're having an allergic reaction to something, or having issues with allergens?
So you'll normally experience a runny or stuffy nose. You could experience watery or itchy eyes. You could also have itchy skin. Or you could get some nasal congestion, so I guess stuffy nose.
Stuffy nose. Okay.
Yeah.
And sometimes it's not common, I guess more so with allergic rhinitis specifically, but allergens in general. Some people may complain of having weird rashes or hives, things like that. So with the skin itchiness, that could be also a trigger point. Because they sometimes say with allergies, you could also have a problem with say animal scratches and things like that, where it can trigger that allergic response. That's also there too.
Right.
So kind of taking a look at it. So one of the biggest things that we are always looking for is, with allergies, what are some things that people could do that maybe they don't require, say, medications to use to treat it right away? What are some things that people at home could try to do to help prevent it?
So although it's not really practical, the best thing you can do to try to prevent these symptoms is to avoid things that you're allergic to, which obviously isn't always easy. So going over some of the different allergens, so pollen, it's best to stay indoors when the counts are high. So counts are normally high in the morning and the midday, and they're lowest after a heavy rain. You can also take showers immediately after being outside, or change your clothes. And you can also keep your doors and windows shut so that, all of that isn't coming in to your home and irritating your nose. Yeah.
I was going to say, I always jokingly say one of the funniest things is when they're typically when you go out to your car, for example, and you just see if you
all
didn't have
over.
Yeah, you don't have say you didn't have access to a computer or anything to see those pollen counts, just to look at your car, just see it coded in yellow, that's a high pollen type of day.
Yeah.
So you may want to be a little more cautious about going out constantly or doing anything there. So.
And then for dust mites, they like to thrive in warm, humid environments. So if you run a dehumidifier and you try to keep it less than 40% humidity in your house, that could help. You could also remove carpet that also harbors dust mites. And you also want to make sure you wash your bedding quite often, probably once a week in hot water. And then they also do sell hypoallergenic bedding and pillowcases and stuff like that.
Perfect. So yeah, kind of looking at it right now, I know one of the other things that they sometimes mention is like the filters in your household too can make a big difference. Because especially people in like older houses, one of the things that they always say is if you don't change out your filter, it can only block so much stuff, and then all you're getting is the same type of things where you're getting a lot of that dirt and debris coming through as well. So
Right.
So in regards to like say pet dander, because that's another common one, like what are some things people could do for that as well?
So obviously that's a hard one because we all love our pets. They do make pet breeds that are more hypoallergenic. They produce fewer allergens. Something else that might help is to bathe your pet at least like once or twice a week if you can. I know that might be a little irritating to them. You can minimize like carpet and fabrics in your house that might hold onto the pet dander. I also say that the vacuum is your friend, as it is in my household. To get a vacuum with like a HEPA filter is like the best option to reduce allergens. And then also you can make sure you're washing your hands every time you interact with your pet before touching your face or anything like that.
Perfect. Yeah. So luckily we don't have to get rid of our animals if that's truly the case. So, so with looking at those types of things right now, what they'll sometimes say is like, we've got people that are following through. So vacuuming everything, they're cleaning, they're washing their bed sheets, they're doing everything that they can, but they're still having problems. So kind of taking a look at it, like, so we'll kind of step more into the realm of like the medication side of things. Mm-hmm. So like what types of medicines do they have out there that could potentially help?
So there's typically like 4 different kinds of classes of medications that can help. So these are generally things like your antihistamines, your decongestants, your inhaled corticosteroids, and there's also something called a leukotriene receptor antagonist. Those aren't very common, but they are there. And most of these are actually available over the counter. So you don't necessarily have to go to the doctor to prevent your allergies.
Yeah. So kind of breaking it down, because you gave us a few different things to look at. So starting off with like, probably the most common one that you normally hear about is like oral medications, because people are taking pills for allergies in general. Mm-hmm. So kind of breaking that down, like what do we have available that's out there for?
So typically we have an oral antihistamine, and we also have oral decongestants. So one option that we generally hear about is Benadryl. That's pretty commonly known, also called diphenhydramine. This is available over the counter. You wouldn't want to take this with any other like sedating medications because, like I said, it can make you really tired. It's generally an onset of about 20 to 30 minutes. So you would have to dose it about every 4 to 6 hours. And you want to make sure you use this in caution for people that have like cardiovascular disease, any hypertension, so high blood pressure, any conditions that cause urinary retention, and asthma. We also have a second generation antihistamines, and these are things like Claritin, Zyrtec, Allegra. These also come over the counter. These should be taken like prophylactically because they can have an onset of like 1 to 2 hours. So you can take them like just once a day. Mm-hmm. And most commonly, the side effect with these is just headache. So these are a lot better for, say, people over 65 because they don't have as many side effects. And then for our oral decongestants, these are things like you hear of like Sudafed and Sudafed PE. So Sudafed PE has phenylephrine in it. That's the active ingredient, and you will actually see this in a lot of like combination products that are over the counter. The Sudafed particularly is something that you have to buy at the pharmacy counter. You have to display your license for this. And these will provide like relief for nasal and sinus congestion only. So these won't help with the symptoms such as like the runniness or the itchiness or anything like that. So the onset of action of these is about 30 minutes, so it's not recommended for long-term use. And these also come in the combo products. So these, you can find like Claritin D, Zyrtec D. So this means that you get an oral antihistamine with your decongestant, so then it hits all of the symptoms rather than just the sinus congestion.
Yeah.
So
yeah, one of the things that I always tell people about is like with those particular products, one of the hardest things is the phenylephrine does a pretty good job because, like you said, it's in most cough and cold medications. So if you ever look at, say, like, you know, any of the like pill forms that are out there for like sinus and headaches, or, you know, the basic like cough and cold, so NyQuil, Dayquil situations, they sometimes have those included in it. The big thing with the Sudafed portion, and like you said, is it has to be behind the counter. And what people don't realize is that there's a daily limit in regards to how much you can purchase per day. So sometimes I always tell people, you know, don't get mad at the pharmacy because you can't buy like 5 boxes of it if the whole family's using it. It's something that's controlled both at the state and federal levels, so it's one of those things that we always have to be careful about. And there are monthly limits too. So if you're buying more than typically like once a day with some of those medicines, like Claritin D, for example, it will limit you. So if multiple family members are using it, the recommendation that I always find for some people is talk to your doctor. If they're willing to write a prescription for it, some insurance companies may cover it, but if they don't, then most pharmacies, if you ask them, will normally cover it at the same cost that you would be paying out of pocket. And with that being the case, it allows to remove those restrictions, so it makes life a little bit easier. So with that, you don't have to run into the problem of, you know, I can only buy so much in a day. This way, the doctor's kind of monitoring it, so it makes life a little bit easier there too.
yeah. And these agents actually, they do cause hypertension. So you want to be careful when buying these over the counter. A lot of pharmacies do have a station where you can check your blood pressure. So if that's something that you're considering on buying, you might want to do that before purchasing. These can also make you feel like restless, jittery. You don't want to take these before you go to bed. You might not sleep.
Yep.
And then lastly, there is something called a leukotriene receptor antagonist. These are prescription only. This is something like Singulair, which is called Montelukast. These provide very minimal benefit. These are kind of like a last line option.
Yeah. So one of the things that we didn't quite touch on just yet that I'd be a little bit more curious about is like with the nasal medications. So sometimes for like oral stuff, like the oral medications, one of the biggest issues that we come across, especially with like the daily, you know, Claritin, Zyrtec, stuff like that, is sometimes it can cause severe, like you said, dryness and other things that can occur. And especially Benadryl is notorious for it. So personally speaking, I don't like using Benadryl for allergies. I always recommend to people like use it for an emergency. So if you're having like a severe allergic reaction to, say, a bee sting, or say you're coming across poison ivy or something, and it's just driving you absolutely nuts, or it's causing severe issues, that would be good for those particular cases. But if you couldn't take something orally, so nasal-wise, like there's sprays and things like that that exist. So what are some ones that we'd be looking out for?
So they do make antihistamines in a nasal spray. These will provide relief for like nasal itching, sneezing, runny nose. They do provide a little bit of relief for congestion or stuffy nose. So these may leave like a bitter taste in your mouth. The onset of action is about 15 to 30 minutes, but these aren't something you want to use every day. These are called, you can find them over the counter as elastine, and it's also called Astapro. There are prescription-based medicines also. One is called Patanase or olopatadine. This can cause nosebleeds though, and these medications, they could also make you feel drowsy, give you a headache, and they can also produce like more cold-like symptoms. So they're not always the best when it comes to your options. They do also make a nasal decongestant that these are generally called like neosynephrine. This is another form of phenylephrine over the counter, and they also make Afrin nasal spray, which is oxymetolazine, and that can also be found over the counter. These, their onset's about 10 to 20 minutes. You don't want to use these for any longer than 3 to 5 days, because they can cause like a rebound congestion. So then you'll feel like your stuffy nose is never going away. These can also cause like a burning, stinging sensation that's uncomfortable, and you only want to use these if needed. You don't want to excessively use these agents.
Yeah, one of the biggest things that we normally come across, and this was like old terminology, but they always termed it as Afrin addicts, is what they jokingly said. The biggest issue that we run into, Afrin's probably the most notorious out of everything that you listed there. But like you said, we want to limit that one down to 3 days, no more than that, only by the sheer fact that, like you said, the rebound congestion can be so severe for patients that use it longer than that, that literally you will be pounding away at using it in order to get any relief. And the problem is, it's just because of the way that it works, you're going to keep causing that issue to occur. So most of the time I always tell people 3 days at most, and then give yourself a break from it. You may use something else in the meantime to try and help out with it, but yeah, like you said, we got to be real careful with that particular class there. So
yeah, and the best option for nasal products over the counter are intranasal corticosteroids, and these will provide relief for basically all of your symptoms: your itching, your nasal itching, your sneezing, your runny nose, stuffy nose. It might provide a little like eye itch relief. But this is basically a first-line choice for either mild or severe, intermittent or persistent symptoms. So the only bad thing about these agents is you can't really get a maximum benefit until you've used them for at least 2 weeks. So in the onset is about like 7 to 12 hours. So this isn't an agent where you're going to get like quick relief. So these agents are things like Rhinocort over the counter, Flonase, Nasonex, and Nasacort. There are also some prescription options, but there are a lot available over the counter. And these don't really cause like a lot of side effects. You might get some nosebleeds, cough, headache, maybe sore throat. But these are the best options out there as of right now.
yeah. So yeah, I mean, like you said, there's plenty of options that exist that, you know, we don't necessarily need a prescription for, but once again, it's one of those things where if there's ever doubts or questions, I mean, by all means, that's what pharmacists are there for. We're there to help try and narrow down your choices and make it a little bit easier to figure out what's going on with that.
Yep.
So if worse comes to worse, if these options are just not working for you, what would you recommend to somebody to do at that point?
I would recommend to definitely consult your doctor, especially if you're taking these agents and your symptoms are not getting any better, and they haven't gotten, or even if they've gotten worse, but if they definitely haven't gotten better for at least treatment for 2 to 4 weeks, you definitely want to call your doctor and have him check you out, because there can be other symptoms that you may have, like things like a fever or shortness of breath or even chest congestion, or things that you're not noticing that might be symptomatic of a different disease state.
Mm-hmm. Yeah, one of the biggest issues with allergies is, like you said, even at the beginning we mentioned it, is the symptoms present so similarly to other things. So like colds, flus, even COVID right now is a problem because it's all so similar to each other. Mm-hmm. But like you mentioned, like some certain things like sinus infections is another big one that people tend to develop with, if your sinuses get really bad and they're not put under control within time, it can lead to an infection that could be like bacterial in nature. And sadly, it's going to require some form of antibiotic to help knock that out. So, yeah. Are there any other options just in case? So like if somebody didn't want to go the medication route that they could possibly do that would help them out with allergies?
Yeah, so if your allergies are becoming too severe or limiting for you, there is options available such as allergy shots. And an allergy specialist can do like a skin prick test or a blood test and find out exactly what allergens you're allergic to. And then they use an allergy shot to treat specific allergens. So they basically do an allergy shot either bi-weekly or monthly for about 3 to 5 years, and that treats the symptoms.
Yeah. I jokingly say some people compare it to being like a tic-tac-toe board because they literally do form a little spot on your back most of the time, especially if they're doing multiple checks, and they put little samples of everything and then kind of see what triggers any kind of response there. So.
Yeah.
Well, thank you so much for talking about that. I mean, it's a lot of information, but it seemed like it was necessary because, like I said, I get questions about this all the time, so it's good to kind of cover that. So thank you so much for doing that.
Thank you for having me.
Yeah. That kind of concludes today's episode of Fun Facts at the Pharmacy. Once again, as we always like to say, if you have any questions, concerns about anything that we've talked about, or if something piqued your interest, by all means, double check with your pharmacist, your physicians, your nurses, anybody in the healthcare field that can potentially help you out with that. Because like I said, there's so many different options out there. To narrow it down for you may take a few questions that we need to know, but we always want to make sure that we're getting you the best treatment possible that's out there. But until next time, thank you so much for tuning in.